السلام عليكم طلابنا الأعزاء، رجعنا لكم مرة ثانية لتكملة محاضرات الجراحة للفصل الأول. محاضرتنا اليوم dentoalveolar injuries.
First of all, we will define the term dentoalveolar injury. Dentoalveolar injury mean any trauma that localized to the teeth and the supporting structure of the alveolus bone. So, dentoalveolar injury هي أي تروما تسبب في injury للأسنان أو إلى soft tissue surrounding the teeth أو إلى alveolar bone, whether mandible or maxilla. Those injuries may occur in isolation or in combination. يعني ممكن أن يصير fracture بالتوث وفراكتشر بالبون، ممكن يصير fracture بالتوث واحدة، ممكن يصير fracture بالبون واحدة, and so on depending on the cause. What are causes of dentoalveolar injury? Dentoalveolar injury occur in different age group. In each age group, the causes differ from other age group. As in children, the most common type of injury is injury to the anterior teeth due to falling. In older age group, there are many causes for dentoalveolar injuries, as contact in sport or industrial activity, falling down, road traffic accident, any other violence, and so on. Also, male are more frequently involved in such injuries than the females. Later on, we will talk about what factor affecting dentoalveolar injuries. There are several factors affecting dentoalveolar injuries. First of all, type of trauma. شو نقصد بالtype of trauma؟ يعني السبب اللي سوى هذا الفراكتشر. We have two types, direct trauma or indirect trauma. Mostly with direct trauma, the maxillary incisor are the most frequently traumatized teeth, especially if we have a dentition of class 2 division malocclusion, if they are protruded. And the second, indirect trauma due to any injury to the lower chin. It may lead to affect any teeth in the maxilla or the mandible, any road traffic accident, any violence due to this indirect trauma. Other factor affecting the dentoalveolar fracture is the extent of the injury, and also the extent of the injury depends on the force of the impact. Is the force low velocity or the force was high velocity? Also, the extent of the injury depends on the object. Like sharp object favor the crown fracture, while blunt object usually result in luxation of root fracture. Direction of the impacting force also affecting is one of the factor affecting dentoalveolar fractures. هسه نحكي how we classify the dentoalveolar fracture. مثل ما قلنا بالبداية, dentoalveolar fracture يعني إما fracture to the teeth أو alone, or fracture to the bone alone, or fracture to the soft tissue alone, or combination of these fractures. So we can classify dentoalveolar fracture into أولا, injury to the hard dental tissue of the tooth and the pulp. Second, injury to the periodontal tissue surrounding the teeth. Three, injuries to the supporting bone, whether maxilla or mandible. Four, injuries to the gingiva and oral mucosa. 5, combination of more than one of these fractures. يعني ممكن يصير fracture للتوث واحدة, ممكن يصير fracture للبريودنتال tissue واحدة, ممكن يصير fracture للسupporting bone واحدة, ممكن يصير fracture للميوكوزا وحدها, ممكن يصير fracture of more than one, يعني teeth زائدا bone, teeth زائدا soft tissue, teeth زائدا mucosa, and so on. هسه نحكي على injuries to the hard dental tissue and pulp, يعني injuries to the teeth. شو ممكن يصير بالteeth من injuries؟ أولا ممكن يصير crown infraction. What is the crown infraction؟ يعني the crown infraction هي loss of or crack in the enamel of the tooth without losing the tooth substance. مجرد crack يصير بالenamel. Uncomplicated crown fracture, which confined to the fracture in the enamel or involving the enamel of the dentin without involving the pulp. complicated crown fracture. Here the fracture will involve the enamel, dentin, with exposure of the pulp, زائدا exposure of the pulp. Uncomplicated crown root fracture. هنا الفراكشر will include enamel, dentin, cementum without pulp exposure. Complicated crown root fracture. بهالحالة راح يصير الفراكشر وين؟ معناها الفراكشر بالانامل، بالدنتين، بالسمنتم and زائدا pulp exposure. Root fracture involving dentin, cementum and the pulp. هنا مثل ما نشوف بهذا السلايد انه التوث fracture could be either horizontal fracture or vertical fracture. الصورة الأولى اللي عليها السهم الأصفر تشوفنا انه اكو vertical fracture بالتوث splitting the tooth into two pieces from the يعني incisal edge to the root, while the second X-ray shows an horizontal fracture extending from the cementum mesial side to include the cementum, the dentin and the pulp to the distal side. So we have two types of fracture of teeth, either vertical fracture or horizontal fracture. هسه نحكي على الانجريز to the periodontal tissue. شنو هي الانجريز اللي ممكن تصير للبريودنتال tissue due to dentoalveolar fracture؟ ممكن أن يصير النوع الأول concussion. What is concussion? Concussion is an injury to the periodontal tissue surrounding a tooth after trauma اللي راح يصير إنه without displacement of the tooth, without loosening of the tooth. يعني راح تصير تراما للبريودنتال tissue surrounding التوث، والتوث راح يظل ما بأي حركة ولا متحرك، متغير مكانه، متحرك أو طالع من مكانه. Okay. Second, subluxation. Subluxation here an injury to the tooth support structure with abnormal loosening but without displacement of the tooth. هنا راح يصير انه due to the trauma يصير loosening بالtooth، يصير بيه slight mobility، لكن still the tooth not displaced from its position. A third type of trauma, intrusive luxation. What is intrusive luxation? Intrusive luxation is a displacement of the tooth into the alveolar bone in addition to the fracture of the alveolar socket. يعني الtooth due to the trauma, the tooth will be pushed upward inside the alveolar bone زائدا fracture of the socket of the tooth. The fourth type, extrusive luxation. Extrusive luxation is a partial displacement of the tooth out of the alveolar socket. عكس الintrusive. بالعكس الtooth هنا partially displaced out of the alveolar bone. النوع الخامس من التراما للبريودنتال tissue is the lateral luxation. والlateral luxation هي is the displacement of a tooth in a direction other than the axial direction. يعني باتجاه غير الاكزيال direction، يعني لا هو داخل بالالفيولار بون ولا هو طالع من الالفيولار بون in a lateral direction. 6. الavulsion. الavulsion هو complete displacement of the tooth out of the alveolar socket. التوث بالكامل يطلع من الالفيولار socket بحيث يجي البيشنت شايل التوث بيده after trauma especially for children، تصير انه complete removal of the tooth from الالفيولار bone. Now injuries to the supporting alveolar bone. شنو هي الانجريز اللي ممكن تصير to the alveolar bone after dentoalveolar trauma? First of all, comminution of the alveolar socket. Second, fracture of a single alveolar socket wall. 3. Fracture of both walls of the socket or alveolus. And 4. Fracture of maxilla or mandible. النوع الأول اللي هو comminution of the alveolar socket، اللي راح يصير هنا راح يصير crushing of the alveolar socket mostly occur within the intrusive luxation of teeth and the lateral luxation of teeth. A fracture of a single alveolar socket wall، هنا اللي راح يصير انه يصير fracture either الbuccal or lingual wall of the bone. 3 fracture of both wall of the socket or الالفيولس، يعني راح يصير fracture بالfacial والlingual or الbuccal والlingual wall of the socket. A fracture of maxilla and mandible, here fracture will involve the alveolar bone with or without the socket. آخر شيء راح نحكي على injuries to the gingiva or oral mucosa. We have 3 types of injuries to the gingiva or oral mucosa: contusion, abrasion, or laceration. First of all, contusion. What is contusion? بالعربي معناها كدمة. It is a bruise usually produced by impact from a blunt object and result in a rupture of small blood vessels or capillaries, and this rupture of these small blood vessels will lead to a submucosal hemorrhage without breaking in the mucosa. Second, abrasion, تآكل. It is a superficial wound produced by scraping of the mucosa, leaving a raw bleeding surface. 3. Laceration, تمزق. It is a shallow or deep wound in the mucosa, result by tear, and is usually produced by a sharp object. Examination and the clinical manifestation. A complete history for the mechanism and event of the injury should be obtained from the patient. Later on, a thorough clinical and radiographical examination should be performed quickly to ensure a proper diagnosis and treatment. For clinical examination, as we know, clinical examination include inspection and palpation. Inspection يعني واحد يباوع بعينه ويشوف شنو اللي صاير. Palpation by our finger we can palpate the structures الموجودة بالoral cavity, the soft tissue, the teeth, the bone, to see what happened during the dentoalveolar injury. So, soft tissue of the oral cavity should be examined for any laceration, abrasion, any damage to the vital structure such as the parotid duct, submandibular duct, nerves, and the blood vessels. The teeth should be examined also for abnormal mobility, and if there is any mobility within the tooth, we should know the direction of this mobility. Is it an horizontal direction or axial direction? Tooth should be accounted for at the time of examination. Missing teeth or pieces of teeth that have not been left at the accident must be considered to have been aspirated, swallowed, or displaced into the soft tissue of the lip, cheek, floor of the mouth, nasal cavity or maxillary sinuses. Dentoalveolar fracture are commonly associated with significant damage to the lip, so the lip should be examined for any laceration, abrasion, swelling, accumulation of blood, and if there is any foreign body or piece of a tooth, fractured tooth embedded inside a lip. The direction of tooth displacement should be noted, especially in primary dentition if the patient is a child, in primary dentition to avoid any injury to the permanent dentition present inside the bone. The involved tooth or teeth should be examined by percussion within the handle of the mouth mirror. Pain during percussion may give us an idea about there is a suggestive of injury to the periodontal ligament. Even the type of sound present during palpation can give us during percussion can give us an idea about diagnosis of the condition. Pulse testing during the acute phase of injury is of a questionable value. Later on, radiographic examination should be taken to the patient. In many instances, one radiograph can tell us a lot of information about the accident, so we may need more than one radiograph, as we may need periapical radiograph with occlusal, or sometimes even we may need an extraoral radiographs. All these type of radiographs can provide us with information about the dentoalveolar injury present. Tell us about أولا إذا أكو أي root fracture ثانيا degree of extrusion or intrusion of teeth. 3 extent of root development especially in children. 4 size of the pulp chamber and the root canal. 5 tooth fragment and foreign body logged into the soft tissue. Those fragments and foreign bodies logged in soft tissue as logged within a cheek or within a lip could be viewed within a radiograph by placing a radiographical film inside the soft tissue to be examined labial to the alveolus with using a reduced radiographic exposure time. Treatment of dentoalveolar fracture. Several factors should be considered before giving a treatment plan for a dentoalveolar fracture. These factors include age of the patient and the degree of cooperations. Second, if the injury involves primary or permanent teeth and the degree of root development, and if the apical foramen is wide or narrow at the time of the accident. 3, location and extent of the injury. 4, residual bone support. 5, periodontal health of the remaining teeth. 6, vitality of the teeth. 7, injury to the soft tissue if present. 9, time between trauma and the treatment. كل هذول الفاكتورز كلهم يكون لهم تأثير على نوع التريتمنت بلان اللي راح نخليها. عمر المريض إذا child or not، نوع الدنتيشن الموجودة whether it's primary or secondary. إذا primary العلاقة ويا البيرمننت توث الموجود بالالفيولار بون، البون الكونديشن of the bone supporting، البريودنتال كونديشن، التوث vital or not، التايم بين التراما وما اجى المريض حتى احنا نقدر نعالجه. كل هذه factors مهمة for the treatment plan. Now we switch to the treatment plan. First of all, we will talk about a crown infraction. crown infraction قلنا راح تبدي يعني الكراون injuries من الانفراكشن إلى complicated crown root fracture. كل واحد من عندهم راح يكون إلى treatment تختلف عن الآخر. بالنسبة إلى الكراون infraction اللي هو مجرد يعني فشي كلش بسيط بالكراون، فد فراكتشر او خلينا نقول مثل الفطر كلش بسيط بالكراون. ف evaluation is by the direct trans elimination by using a light to see if there is any minute infraction within the crown. No treatment is required for cracks. Vitality test should be performed at the time of diagnosis and follow up of the patient later on to see if there is any new events within the teeth. For the crown fracture، الكراون fracture قلنا ممكن أن يكون بس الإنامل، ممكن أن يكون إنامل ودنتين، ممكن يكون إنامل زائد دنتين زائدا البالب، ممكن أن يكون uncomplicated crown root fracture، وممكن أن يكون complicated crown root fracture. فبالنسبة إلى in case of enamel fracture or the fracture is limited to the enamel, all we need is smoothing of the sharp edge of the fractured part and restoration within a composite. If there is a fracture in the enamel and dentine, required covering the exposed dentine with calcium hydroxide and restoration within a composite. A crown fracture والpulp exposure، البرايمري aim هنا مالتنا راح يصير الخطوة الأهم أن شلون نحافظ على vitality of the tooth. So the primary aim to preserve vitality of the pulp. A treatment either by pulp capping with calcium hydroxide or MTA, pulpotomy or endodontic treatment for the tooth. A crown root fracture in this condition aim مالتنا راح يكون to preserve the remaining root fragment to support a post crown. يعني الكراون راح ممكن الايم مالتنا راح يكون انه شلون نحافظ على البيس مال الروت الباقيه حتى نسوي عليها later on post crown احسن مما نوصل الى مرحله الاكستراكشن. Complicated crown root fracture, the level of a root fracture here will determine the treatment. Extraction is usually indicated if the coronal segment include more than 1/3 of the clinical root, or in case of vertical root fracture. Otherwise, the tooth may be treated endodontically and restored. Treatment of root fracture. For treatment of root fracture, we have, as we said before, either a horizontal fracture of the root or vertical fracture of the root. The horizontal fracture of the root could be divided into apical, midroot, or cervical, depending on a level of the fracture of the root. First of all, we will talk about the primary dentition when there is a fracture in the root in primary dentition. In children, if there is a fracture of a root and there is no mobility of the tooth, in this condition no treatment could be done, and the tooth could be preserved and later on exfoliated normally at the time of its exfoliation. But in cases where there is a fracture of a root of a primary tooth with mobility of the coronal portion of the tooth, so in this condition this piece should be removed and the apical part of the root should be preserved in order not to damage the permanent teeth which are lay beneath this primary tooth. In cases of root fracture of a permanent teeth, in this condition, the treatment plan will depend on the level of the fracture line in the root. Is it in the apical portion? Is it in the middle root area, or in the cervical area of the root? In cases where there is a fracture in the root in the apical portion, in this condition, the prognosis is good because a calcified or fibrous bridge will happen, and this will lead to healing of the root, particularly if the fracture is the inapical third. Where if the fracture is in the mid-root area, in this condition, the prognosis also is good. Injuries to the periodontal tissue. Treatment of injuries of periodontal tissue involve the following: concussion. In case of concussion, usually no treatment is indicated other than palliative treatment. In many cases, also relieving of the tooth from the occlusal force by grinding of the opposing teeth may be indicated. Periodic follow-up to the patient to evaluate the condition of the pulp. Subluxation. مثل ما قلنا بالبداية انه subluxation تعني انه صار loosening بالtooth without displacement. In this condition, the treatment includes soft diet or occlusal adjustment to remove the tooth from traumatic effect of occlusion. Sometimes splinting for 7 to 10 days is necessary with periodic follow-up for the patient for evaluation of the condition. فإذا نلاحظ على الصورة الثانية اللي بالسلايد إنه أكو laceration سوينا لها suturing، أكو slight loosening بالتوث سوينا لها fixation بأبسط أنواع الفixation اللي هي by using الcomposite for 7 to 10 days with follow-up for the case. intrusive luxation. مثل ما قلنا أيضا بالبداية إنه الintrusive luxation يعني معناها التوث صار بmobility زائدا placement into the alveolar bone. So what's the treatment of intrusive luxation? If the tooth is a primary tooth, in case of a primary dentition, always we should pay attention to the permanent tooth, which always lays lingually to the primary teeth. If the intruded tooth impinge on the permanent teeth, then the primary tooth should be extracted immediately as atraumatic as much as possible, and to prevent any injury to the underneath bud of permanent tooth. Intrusive luxation occur within a permanent teeth, so the treatment plan will be immediate surgical reposition of the tooth into the proper place in the arch, and splinting to the adjacent teeth for 3 to 4 weeks to allow remodeling of the bone and periodontal fibers. مثل ما نشوف اكو laceration سوينا لها switchering. Then we try to reposition الtooth اللي هو هنا central as much as possible in its normal position. زائدا splinting of this tooth to the other teeth for a few weeks. Extrusive luxation. قلنا بالبداية الاكستروسيف luxation هي partial displacement of the tooth outside الalveolar bone. If the tooth is a primary tooth, so in this condition, the tooth should be extracted immediately. In cases where a tooth is a permanent tooth, treatment should be started as soon as possible within the first few hours after injury. The tooth that is partially displaced out of the alveolar socket should be manipulated into its normal position and should be supplanted with non-rigid material for 1 to 2 weeks to allow for some physiologic movement of the involved tooth so that ankylosis may be prevented. مثل ما نشوف أيضا نرجع التوث بالنورمال بوزيشن زائدا سبلنتنج هنا باي واير اند composites. Evulsion. والإيفولشن قلنا هي total removal of the tooth from its socket or from الalveolar bone as a treatment for evulsed tooth. هي immediate replacement of the tooth is still the ideal treatment. The involved tooth should be supplanted with semi-rigid supplant for 7 to 10 days. Rigid supplant of re-implanted teeth increase the extent of root resorption. So we should introduce the tooth into its normal position with supplanting. There are many factors affect the prognosis of this treatment. The factors affect the prognosis of this treatment include the stage of a root development, يعني a root completely formed or uncompletely formed. In cases of completely formed, the diagnosis راح يكون better. The length of time of a tooth allowed to be dried or outside the oral cavity. إذا صار عندنا التوث is reimplanted within 30 minutes البروجنوسيس راح يكون better. كل ما تزداد الفترة الزمنية راح يكون البروجنوسيس worse. 3 الميديوم use for handling of the tooth يعني الميديوم اللي ينحفظ به التوث حتى نوصل للدنتال اوفيس. و there are many mediums يعني used مثلا السلايفا السلاين الملك والملك يعتبر هو البست medium because أولا available. ثانيا ال pH compatibility to the vital cell. 3 freedom from bacteria. And 4 function of maintaining the vitality of periodontal ligament. While the water is the less desirable storage medium because it is hypotonic environment and it is can cause lysis of the cells. Injuries to the supporting alveolar wall. As a treatment for injuries to the supporting alveolar wall, a close reduction of the fracture by digital manipulation should be done. The occlusion should be checked and the involved teeth removed from the force of a traumatic occlusion. Soft tissue laceration should be sutured and the involved teeth should be in a rigid supplant for 4 weeks to allow for osseous healing. Injuries to the gingiva. Whenever we have injury to the gingiva, a copious irrigation for the gingival wound is necessary. Then suturing of the laceration with a suitable antiseptic mouthwash prescribed for the patient.
Now we will talk about supplanting technique. What is a supplanting technique? Supplanting is a technique provides stabilization of the traumatized teeth and prevent further damage to the pulp and periodontal tissue during the healing process, allowing the attachment apparatus time to regenerate. In most cases, supplant should be maintained for 10 to 14 days, and longer periods are required for alveolar bone fracture, as about 6 weeks, and sometime for root fracture 2 to 4 months may be required. مثل ما تشوفون يعني الجدول اللي موجود عندنا السبلنتينج انه هو في الطريقه نقدر نحافظ بها على التيث انه stabilization للتيث او التشو اللي صار به انجري، وبالتالي حتى نسرع بالهيلينج. الستابلايزيشن بيريود تختلف من انجري الى انجري مثل ما تشوفون بالجدول. الموبايل توث ممكن نخليه لديوريشن اوف immobilization 7 to 10 days. التوث displacement need 2 to 3 weeks of immobilization يعني period. Root fracture may need 2 to 4 months immobilization period. Evulsed tooth may need 7 to 10 days of immobilization. And alveolar bone fracture we have يعني 4 to 6 weeks. Now we will talk about types of splinting. The first method for splinting is enamel bonded composite resin splint. The first method for stabilization of dentoalveolar fracture is by using the static composite resin material. This method have many advantages, as it is easy method, hygienic, provide excellent stabilization for the dentoalveolar يعني injuries, keep the teeth and the gingiva clear because the splint is away from the periodontal tissue, and not required anesthesia in many cases, but it has one disadvantage, that the material can be fractured, as the acrylic is brittle material when exposed to occlusion masticatory force. مثل ما نشوف بالصورة استعملنا الكومبوزيت resin as a splint for splinting of those lower anterior teeth. وقلنا هاي الطريقة بها many advantages، لكن بها واحدة disadvantage انه يعني الاكريليك او الكومبوزيت هو material brittle within يعني under the force of mastication.
H-wire composite splint. The wire should be of proper stiffness. It's used in all type. This method is used in all type of dentoalveolar trauma like luxation injury, root fracture, and alveolar fracture, in which good stabilization can be obtained. This technique is aesthetic, hygienic, quick to construct. It's useful with missing teeth or in mixed dentition in which teeth are not fully erupted and the edentulous area has to be spanned. The only teeth that might not be suitable for this type of splint are those with artificial crown or large filling. Cup splints. They include metal or heat or cold curing acrylic splints. This technique requires reduction into correct position and then accurate impression of teeth and both jaw. It provides excellent immobilization and protection of the traumatized teeth. Orthodontic appliance. Orthodontic bracket and arch wire can be used to provide support for traumatized teeth, but they should be always as passive. Another method for immobilization is by using an arch bar with wires. They are used for stabilization of alveolar process fracture if the teeth within the segment are stable, and can also use for supporting subluxated teeth, but they are not recommended to be used for teeth fixation because the tied wire tends to loosen within time and rest on the marginal gingiva, causing mechanical irritation and site of bacterial deposition. Another method for immobilization, interdental wiring technique. They can be used also, but they are technically difficult. The patients may have difficulty in cleaning around the wires, and the wires may be slip apically below the cervical prominence of the teeth and elevate the tooth itself. There are several techniques for the the interdental wiring, figure of 8 wiring, using soft stainless steel wire around the abutment teeth and the subluxated tooth in a figure of 8 manner. They can also be used as a temporary form of immobilization. With second technique, loop wiring, which provides slightly better immobilization for subluxated teeth. A length of wire is passed as a single loop around the cervical margins of the subluxated and adjacent teeth. This loop is loosely tightened, then individual wire passing interdentally above and below the loop wire are tightened. Finally, the original loop wire is twisted tightly. Complication of dentoalveolar fracture. There are several complications of dentoalveolar fracture. First of all, traumatized teeth may develop pulpitis or become devitalized, and with time this frequently leads to development of periapical infection. Second, discoloration of traumatized teeth. 3, local gingivitis, especially when there is severe interdental force applied on the gingiva, leading to periodontal problem. 4, untreated alveolar fracture either unite in an incorrect position or become infected, often with sequestration of detached fragment of the bone. 5, tooth fragment or foreign bodies embedded in the lip usually heal over and remain as a hard lump that may become infected. 6, root resorption. A root resorption could be either internal resorption or external resorption. External root resorption occur on the outer surface of the root, usually as a result of an inflammatory stimuli, while internal resorption takes place within the root canal system and is less common. And last complication, ankylosis, is a common consequence of several dental trauma. The tooth substance at the area of the damaged periodontal ligament and cementum is progressively replaced by a bone, and this will lead to ankylosis.